It's every parent's dream to see their children grow. And as our children grow, so does their curiosity and, of course, the risk that comes with injuries. So, how do we handle the common injuries that can happen at home? The first common injury is usually an injury to the head. This is very common and mostly we see it from falls. You should be worried in case your child has had a fall and they are cranky. That means they are crying and you cannot really explain when they're crying. They've started vomiting and they were not vomiting before. They are preferring to sleep or they are a bit lethargic than normal. Their speech has changed in any way. They were running and walking and all of a sudden they're not able to run or walk. And if they are still infants, their fontanelle, that means it's the soft spot, is now bulging. So if you see any of these symptoms and your child has had a fall, please remember to go to hospital. And in case your child falls from a height of 1 meter and they are less than 2 years, you need to go to hospital regardless of any symptoms. Or if for those who are 2 years and above and they fall from a height of more than 1.5 meters, please remember to go to hospital. The second common injury that can happen at home is an eye injury. And you're worried if a child has had an eye injury and they actually are having a black eye, or the conjunctiva, that means the white part of the eye has been stained with blood, or they're not able to move their eye. And you will be able to know this if you just tell them you move your finger in front of your child. If they're not able to follow the finger because of pain, or maybe one eye is following and the other eye is not, those are danger signs and you please need to go to hospital as soon as possible. The third most common injury is injuries in the mouth. That means they've had cuts. It is wise you just go to hospital. If your child has had a tooth injury and the tooth has actually fallen off, if it is a milk teeth, make sure you see a dentist within the first 24 hours of the injury. But if the tooth that has fallen is actually a permanent teeth, that is an emergency and you need to go to hospital as soon as possible. But as you go to hospital, this is how you need to handle the tooth. So what you need to do is you hold the tooth from the crown. The crown is the white part of the tooth, the part that we can actually see. So you hold the tooth there and not the root that is where the tooth was attached in the gum. So you hold the tooth on the crown and then you wash it with warm salty water. Then you also wash the socket. The socket is where the tooth was, with warm salty water. And then try as much as you can to place it back and hold it there. And that has to be done within the first 10 minutes of the injury. If you are not able to place the tooth back, maybe because of too much pain or the bleeding is a lot, what you need to do is soak this tooth that has fallen off into warm salty water, and then you may get a cloth, a clean cloth or a gauze, and place it on the child's socket and apply pressure to stop the bleeding and rush into the emergency room. If let's say it's multiple teeth that have been lost, make sure you account for every socket that is empty. The fifth type of injury are usually cuts. Cuts are very common. Whenever you're dealing with a cut, the first thing that you need to do is stop the bleeding. Try to align the skin and then take a cloth and tie it as tight as you can. The purpose is just to stop the bleeding. And if the cut is that deep, then you need to go to hospital as soon as possible. The fourth type of injury is fractures. Fractures means broken bones. It's very common in toddlers and boys who are between 5 and 12 years of age. The common areas that are likely to fracture are usually the elbows, the fingers, the wrists, and fractures of the legs. So how do you tell that someone has a fracture? Of course, pain is extremely severe, and then there's obvious deformity of the area that has been involved. You should be worried if that has happened, and then on top of it you have numbness, or the skin above the area that has been injured has suddenly changed, or there's actually an open wound on that area. What you need to do is do not let that part move. You might have to carry your child if it's on the leg, or you might have to use a sling if it's on the arm. Then the other type of injury, very common in the house, is actually burns. We do have 3 degrees of burn. The first degree is when you just have a skin that has been burnt and there's really there's just blackening of the area, and it's also very painful. Then the second degree is when you have blisters, and then the third degree is when you just have a white patch, like the whole all of the skin has been burnt and it's not even there. So if it's a first degree burn, then you don't really need to worry about it. Once the burn has happened, regardless of the degree, pour cold water on that area. If a child was wearing clothes, remove those clothes by pouring the cold water on the child. Then you need to go to hospital if the burn is a second degree or a third degree. That means if you see blisters or you no longer see the skin, you only see a white patch, then you need to go to hospital for proper dressing and advice. I really hope this is helpful. Thank you for taking time to watch this.